This one's going to be on hypersensitivity reactions. There's 4 types. The objectives are identify them, give examples, and then he just says have more detail of everything. So type 1 is going to be your allergens, and that's going to be what you would expect if you have an allergic reaction right away to something, anything anaphylactic. That's going to be your type 1 hypersensitivity. Type 2 is going to be cell issues. We'll come back to it. Type 3 is more of a system issue, and then type 4 is when your T cells get involved, so your immune system. Quick example of type 1 would be anaphylaxis, like a bee sting, peanuts. It can be anything that's ingested, inhaled. If you get stung with an insect sting or like a medicine that you're allergic to and you have the needle given of that, those are all can be allergic reactions. Type 2, I know some examples are Graves' disease, myasthenia gravis, and I know that myasthenia gravis has to do with your acetylcholine is not being taken up and it's just kind of sitting around, and it kind of leads to muscle weakness because when you use your muscle, it's sending out the signals to stay contracted and use it, and then since it's not being processed normally, it kind of just stays in the way, and then your muscle's not getting new signal sent to it, so it weakens, so you can't have as strong like long-term strength, I guess. Like if you were to hold your hand out in front of you, it would drop very, very quickly if you had myasthenia gravis versus like if you didn't. Type 3, I forget my example. Type 4, the example is kind of like a delayed allergy. So like if you had poison ivy, so if you have an allergic contact dermatitis, that would be type 4. And then I guess I'll have to go into some more detail because I realized I just know the very basic, there's 4 types. Oh, you also have the Coombs test. So there's 2 types. There's the direct and the indirect. So if it's a direct Coombs test, it has to do with your red blood cells. And then if it's indirect, it has to do with the serum and how antibodies react to that. Here's the official descriptions of your hypersensitivities. Type 1 is immediate, so that's going to use IgE, and IgE is known for allergic reactions. It's also known for helping with helminths, and I could get really into it, but that's a different lesson, so just know it uses IgE. It's an immediate allergic reaction. Type 2 is cytotoxic, so it's bad for your cells. The effectors are IgG and IgM. Same with type 3 is IgG and IgM, but it's immune complexes, so not system, but immune complex. And type 4 is delayed, and that's your T cells, so it's within 48 hours. Basically, your first contact with the allergen won't have symptoms, but then you're sensitized, and then when you're re-exposed to it, you'll have a reaction. And then when you're re-exposed, it can either increase or decrease the reaction, which if it's increased, that's your allergen, or like you can't, I think it's called like an immunogen, like it. So if you come in and say like your reaction's like a 5 at first, and then you come back in, the reaction's at like a 7, then like you react so much faster to that same allergen. But if your reaction goes to like a 2, then you have a tolerogen because you started tolerating it. And you're like exposure therapy that people talk about, it's kind of like that. Let's see. IgE comes out of your plasma cells for type 1s. And IgE is going to use mast cells and basophils for inflammation. So it'll cause the degranulation of the cells so that the chemical mediators can come out and do things. Let's see. Your mast cells and basophils are in your mucosa, epithelial surfaces lining your body, which makes sense, like sneezing, coughing, and everything has mucosal linings. And it can happen in seconds, which, as people with allergies have found out, probably. Common allergens, small proteins usually, dried up in particles, and then when you inhale them, then they'll rehydrate, and then your body will pick up on them and attack them. Your Th2 has to do with IgE as well, so that's your T cell, your helper T cell 2, and that is part of CD4, which is part of your immune system. Histamine, that's going to be important. That's going to be what's causing your allergic reaction. And there's 3 histamine receptors. We only really focus on H1 because that's on smooth muscle cells and endothelial cells. That'll constrict your airway, increase mucus secretion, and these are all like getting really into it. I should have previewed this before starting, but it's fine. Anaphylaxis, we talked about. The treatment they list is just using epi really fast. Hives, fancy name is urticaria. Sorry, the Boston dropped the R. It activates the mast cells on your skin. Usually it's from insect bites, and there's something called atopic dermatitis, which is eczema. And, okay. Oh, they bunch together type 2 and type 3. So type 2 is the antibodies binding to cells. Type 3 is immune complex mediated destruction of tissues. So the antibodies are just like your little Y things, and they'll stick to the cells. And then the complexes are a bunch of the Ys that look like they're grouped together. Type 2 is tissue destruction via ADCC. ADCC comes up quite a bit. I think it has to do with like making sure that cancer cells don't become cancer cells, but that's again another lesson. Cytotoxic, when your red blood cells die from drugs, graft rejection, transfusion reactions, or non-cytotoxic versions of type 2 are the cell or tissues altered in function, which is Graves' disease, myasthenia gravis. They also talk about erythroblastosis fetalis, which is cytotoxic. That's when your Rh negative mom gives birth to the Rh positive fetus. So you want to give the mom RhoGAM, which is RHOGAM. It's for basically, if you don't give the mom this drug, she can't have more kids, because if she has a kid that's Rh positive, which is more of the dominant one, her body will be like, hey, this isn't supposed to be here, this isn't part of you, and then try to kill it, and then like she basically couldn't have another kid after the first kid, because that would be like her first exposure. And that's that one. Graves' disease, I told you about myasthenia gravis. So Graves' disease is it has something to do with TSH. I think it's, so it's unregulated overproduction of thyroid hormones. TSH is the thyroid stimulating hormone. So it just keeps making more and more because it's not picking up on them. or not killing them and cleaning them up. Wounds. Serum sickness. That's not good. So they try to make anti-serums to administer to patients for infectious diseases. There's also Arthus reaction, and that looks like an inflamed response, usually in a localized area. Type 4, we talked about 24 to 48 hours. Contact dermatitis, and there's a TB skin test, which if you've ever had to work for the ambulance company, they have you do your little titers, and they'll inject it under the skin, and then they go back in a few days and check to see if anything happened, because it's a delayed hypersensitivity. And that's, well, hypersensitivity, but also it has to do with checking that your vaccinations are active and like working, because again, vaccines, it's another lecture. So our type 4 examples are Th1, Th2, CD4 cytokine production, the CD8 cytotoxic CD8 T cell mediated is like type 1 diabetes. Poison ivy I talked about is CD4 cytokine and CD8 T cell mediated. And the other ones were, so Th1 is a celiac disease, tuberculin skin test, multiple sclerosis. Th2 mediated is chronic asthma. And that's about it. There's a lot of photos. Okay, yeah, that's everything.